right, so thank you for joining us, and let's go straight into our discussion for today. And as we said, our discussion is how exercise conquers diabetes. If you don't have diabetes, it is how exercise conquers high blood sugar levels. Something that will not make you get diabetes. So if you don't have diabetes, don't tune up. You can still watch because, it can help you prevent getting diabetes. All right. So,
especially if your risk factors are such that you have family members that are diabetics, and you have African descent, and you are Asian. Those are the risk factors. So if
45 and over, right?
yes, so if you are not diabetic yet, don't tune out. There are certain things that you can do differently so that you don't end up being diabetic.
So that you don't end up being diabetic. My goodness, my goodness. That is important. Very important. All right. So our topic again is how exercise helps you conquer diabetes or high blood sugars, helps you prevent diabetes from coming on, how exercise helps you also avoid the familiar diabetes. Familiar diabetes meaning genetically inherited diabetes. You may have family members who have it, but we're going to see how exercise can help you to avoid getting that disease, no matter how close those relations are. All right, so that is our talk for today. And with that being said, let's move on to our next thing that we want to talk about. So we want to focus on these areas. The first one is we want to talk about the fact that exercise may improve your glucose uptake. And then I'll also go on the next one, also how exercise may improve insulin sensitivity. How exercise may improve insulin sensitivity. And then give you what to go.
And we will also talk about weight, how exercise can help you manage your weight and your cardio health. And we continue to talk about what types of exercise are very essential in you dealing with diabetes.
And then we will conclude with just a few, two of the exercises we want to stress on, and that is HIIT and interval training as two forms of exercise that can boost your blood sugar levels. All right, and then we will preview our show for next week. So that is what we are going to talk about. Now, with that being said, we have a comment here. Our brother Paul for Kwesi and Paul for says that excellent advice. Come on, man. Thank you so much. Thank you so much. Excellent advice. Yes, the advice is you may not be diabetic yet, but you got to stay tuned so that you don't get diabetes if you can follow these things. And with that, let's move on to our next thing. So the next thing is that if you have not yet clicked the like button, if you have not yet subscribed to our YouTube channel, if you have not yet clicked the follow button on our Facebook page, please do us the honor. Come on, man, do us the honor. Hit the like, hit the follow buttons, and subscribe after watching this. If you are not watching from the YouTube channel, you're watching on Facebook, make sure you go to our YouTube channel. Also, just type in Dr. Oteng, Dr.Oteng, and it will bring you to my beautiful face. You cannot miss my face. And then you can click that. Oh, come on, man. My round face, right? You can click on that and subscribe so that you will be notified each time we go live. And also, we have tons of videos. We have over 100. I think we have more than 100 videos to say. We have definitely more than 100 videos on our channel that you can follow and watch, spanning a lot of health issues, and some even venturing towards some social issues like a marriage and stuff. So don't lose out. Make sure you subscribe. All right, so with that out of the way, let's begin. The first thing we want to talk about is that exercise improves your glucose uptake from your bloodstream.
Yeah, so I think previous videos we've talked about when you ingest food, when you take in food, it is broken down into the simplest form, which is the glucose, right? So it got into your bloodstream and it lingers around. Insulin work on it and it takes into your cells and you have energy and you are able to function well. So if you have diabetes, it's likely that you have excess glucose in your bloodstream. So, and even if you don't have diabetes, your glucose level increases when you eat, right? So when you eat, your glucose level increases. So when you exercise kind of, you are exercising the muscles, so your muscles are contracting and relaxing and contracting. So by doing so, it tends to absorb the glucose into your cells right away without needing a lot of insulin for it to be taken back into your cells. So exercise is very important in the sense that it absorbs the glucose from your bloodstream straight into your muscles because you are exercising. You are breaking down, you are using energy to exercise. So in so doing, you take all the glucose from your blood and into your cells without using much insulin.
Come on, man. That's it. That's about it. That is it. I'll only add a little bit and then we'll move forward because of time. That is everything. She has broken it down in detail. I will bring the story of how we used to be as a people. As people in the past, we used to walk distance, walk miles to hunt for food. When we were first made. But today, in our age, if you walk so much, people will even begin to suspect you, especially if you walk in the neighborhood that you're not familiar at, right? Because people think you should be driving all the time. Not people think. That's the nature of our lives these days.
Society, yeah.
Society. You are driving in a car, you're riding on a train or a bus. Nobody walks more than a mile to go for food. I'm pretty sure not even half mile. Nobody walks for food anymore. You drive, all the way, like even our own lives. I walk to my garage, open the garage door. The only steps I take is from my bedroom or the farthest from my bedroom or bathroom all the way to my garage. When you go to the grocery shop, you park in the parking lot, and the most distance you walk is from parking lot to the entrance of the grocery shop, and basically that's all you do. So if you do not activate yourself in a form of any form of physical activity, and you live the lifestyle of just driving and being on a bus or a taxi and on a train, then every food you eat don't get any use. The glucose you take have no use in your body because there's no work. So this is where exercise becomes very important. So when you exercise, as she said, you are activating the muscles to work. And when they work, then they will be able to use the energy, which is the glucose. If you are not working those muscles, if you are not exercising, the energy that you take in the form of food is just lingering in your blood. And that is why most people are getting diabetic in these days. We have the same genes as before, but 30 years ago, if you check the statistics, diabetes is increasing more. But we are the same people. Why? Because our lifestyle has changed. No exercise, no walking, barely doing any physical activity. So the first thing, especially if you have a family history or the risk factors that she mentioned earlier, then you got to make sure that you consciously, exercise your muscles, consciously exercise in order to reduce the lingering blood glucose in your body. So your body will pick the glucose up, which is in your blood, like the little slide we're showing on the side. Glucose enters the cell because the cell needs it for use. Without exercise, no work, so the food doesn't really go anywhere. It's got to stay in your blood. So that is the one major importance of exercise and the way it sort of conquers blood sugar levels in your blood.
Yeah.
So we can.
Yeah. So like if we are eating, and you mentioned that before this time, like 30 years ago, we were more active because of the culture or the way that we were living. Now there is more car to driving, so we are not physically active like we used to anymore. So like you said, you should be consciously, and us not being very active there's abundance of food now,
Mm.
you know,
It's the exercise is going down and food
and
is
the food is
increasing,
increasing.
and especially sugary foods too.
And the processed foods,
Mm.
because everything is like microwave.
Mm.
Everything is quick, fast, 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 fast. So because of that, that's why diabetes keep increasing. The numbers are going up because we are taking in more but less activity.
Less activity.
So we have to consciously make an effort to do something to use up the sugar, the food that we are ingesting from morning till night. You know, we have to make use of it. Otherwise, it's going to linger around, it's going to stay in our bloodstream. And the best thing it can do is to cause our insulin to work hard on the sugar that is so abundant in our bloodstream, and that will lead to type 2 diabetes. So if you know you can't stay active, then don't eat too much.
Come on, man. If you know you cannot exercise, don't eat. That's simple
Don't
as
eat
that,
at
because you
all.
eat
No,
to
don't
work.
eat too much.
You eat to work hard on your muscles. So if you are not going to exercise, Gifty says, I didn't say. She says, don't eat.
Don't eat too much.
Don't eat too much.
Don't eat too much.
Just taking a little bit, the least amount that will carry you on for the little things you do, like reading and doing your daily activities.
Lying down.
You don't need energy for that. So yes, don't eat much if you don't have any physical activity going, and that's
It's very hard to do.
It is, but some people say calorie in, calorie out. Some people don't believe in that, but basically what it means is that however much you take in, you must be working your muscles hard enough to burn it all.
Right.
If you don't, then the rest will remain stored as fat in you. And as we can know in the future, as we move forward, when you develop some amount of fat around your waist, you are going to have insulin resistance, type 2 diabetes right there. So some people actually count calories. We don't want you to just count calories. Just eat the maximum you feel like you can eat, but then make sure that as you eat, remember that you got to burn that food down by a physical activity of some sort, whether it's a deliberate exercise or some kind of a work or activity that is very physical in nature, in order for you to burn out everything that you take in. Because without that, then your blood glucose is going to keep going up. And especially as you age, especially if you are of a dark race, and especially if you have family history, all those things increase your chance of getting type 2 diabetes. But exercise can reverse those risk factors.
Right.
All right, so we go forward?
Yeah.
All right, so that is exercise improving your glucose uptake and making your blood glucose less. Now, the next one that we're going to talk about is exercise improving your insulin sensitivity. And we want to talk in three ways that exercise improve your insulin sensitivity. In other words, exercise makes your insulin more sensitive. So let me just start down. So if you exercise, your muscles become more sensitive to your insulin. In other words, it will take just a little bit of insulin for your muscles to recognize that, oh, there's sugar in the blood. Let me pick that sugar up and use it. So the more exercise you do, the more your muscles learn to use less insulin. And so you may not be producing much insulin, or whatever, but because your muscles are trained with more exercise, regular exercises, they will learn to pick up the glucose even in the presence of a little bit of insulin. But if you don't have exercise, then the glucose will continue to pile up and your muscles do not use it as much. So exercise basically improves the sensitivity of your muscle cells to insulin. It makes your insulin more effective. It makes your insulin, just efficient, I should say. Also, if you produce little, you achieve greater results. So the muscles will be able to pick up a lot of glucose when you are a person who has regular exercises. So that's a way to control your blood sugar right there, whether you are diabetic or you want to protect yourself from becoming diabetic.
Yeah, and it's also, in another way of saying it lowers the resistance of the insulin. Type 2 diabetes is like some people are able to produce the insulin all right, but it's become so resistant to the sugar that is available in your bloodstream. So it's not able to work on it as much as somebody who does not have diabetes. So if you're type 2, if you're diabetic, it's likely that the insulin that you are producing is resistant. Okay. It doesn't work as well. In other words, it's not sensitive to the glucose uptake. So exercise makes your insulin more sensitive and less resistant. So some people, I think some of the medications we may talk about next week work in such a way that it makes your muscles more, your insulin more sensitive. So instead of taking medication, now exercise can help your system to your insulin to be more sensitive and less resistant. So exercise is very important if you think of it that way. That is not just to control your weight or work your muscle or build up or be puffed up. It's make your insulin very sensitive and less resistant.
All right. Now I'm just gonna throw in. Somebody may say, "But what is resistant?" I'm just gonna
Okay.
use an analogy here to explain insulin resistance. You know how we talk about antibiotic resistance? I'm gonna use the same thing. So, in the presence of pronounced glucose, you have a lot of glucose. If you're eating a lot of sugary foods, a lot of carbohydrates, you're not exercising, and glucose is so much, your body is told to release insulin all the time because the glucose that is coming is so much, it cannot handle it. So, insulin, come out. You eat insulin. You every time insulin is coming out, and so it comes to a point that the body just gives up because they've seen insulin and insulin is every time insulin. So it's now, what is this? I'm tired of insulin, and then it becomes resistant. So the insulin that you produce does not work anymore. It does not work anymore. Why? Because you have produced so much because of the sugars you are eating, because of your starchy foods you're eating, because there's no exercise to pick it up, to pick up the glucose. You're not working out, you're not doing exercise. So, but meanwhile, you are eating these sugary foods, starchy foods all the time. And so the insulin is releasing all the time. Insulin come. But then when the insulin is released, it's not working because there's no exercise to use it. There's no physical activity to use this insulin that, to use this glucose that your body is picking up. And so the insulin becomes resistant. Your body becomes like resistant to the insulin. In other words, kind of like antibiotic resistance. When you use antibiotics for every disease, antibiotic, every disease, antibiotic, every disease, antibiotic, then antibiotics don't work anymore. Why? Because your body has seen it all. All the bacteria knows the antibiotic. So when you have real need for antibiotics and you give antibiotics, they don't work. Same idea. And so if you are eating the starchy foods, you are drinking sugary drinks. If you missed our show last week, make sure you go back and check it out. Some of the foods you shouldn't be eating and some of the drinks you shouldn't be drinking. You are pounding on them. You are eating them. And then there's no work, no exercise, no physical activity to use the glucose that you are introducing into your blood. Insulin gets tired. After being released for so long, and no positive action coming from it, what happens is your body becomes resistant to your own insulin. So for some people who have type 2 diabetes, if you watched our first show on this series of diabetes, we said some people produce normal insulin amounts and yet they are still diabetic. And the reason is that the insulin is not working. No exercise, nothing to use the the glucose that the insulin is picking up from their blood. And so they have become resistant. So what exercise do is that it improves your insulin sensitivity. It turns your insulin resistance around. Because now when you are exercising, your muscles are picking up the glucose and they actually find a use for it. They are changing the glucose to what we call ATP, the energy molecule, and using the energy molecule, getting glucose. Hey, this exercise, the muscle is contracting. Whatever exercise you're doing, they're pulling the glucose into your muscles, burn it up, and use it for energy, for contraction, like Gifty was describing. And so with that going on, the body knows that, oh, okay, so if I release the insulin, glucose is picked up, and that glucose is used during exercise or physical activity. And so then that glucose, that insulin is good. So it will release only when you need it.
Right.
But if you don't exercise and the glucose is released, I mean, the insulin is released, even if glucose is picked up, nothing is used for it. And so the body gives up and becomes not sensitive. I hope that makes it easier to explain as far as the resistance is concerned. So, yes, exercise reduces the insulin resistance. Now, whether or not you are diabetic, some people are diabetic, they are on medications, but they are not doing enough exercise. They think that because they are taking medications and probably insulin, they don't need enough exercise. If you add consistent exercise, some of which we are going to describe later on in this show, you are going to find that the insulin that you use may have to be cut back. The doctor may reduce the amount of insulin that you are injecting yourself. Why? Because now, for the first time, your regular exercise is making use of the glucose. And so, therefore, your body is not resistant to the insulin that you're using anymore. You don't need more to control it because your body has become efficient user of insulin and of glucose.
So on the other hand, if you are not exercising, you are injecting the insulin all right, but you realize that the doctor will keep increasing the units because it's not being
working right.
effective in your system because you are not exercising. So exercise is very important if you are diabetic or if you don't want to be diabetic. We can't stress that enough. You have to incorporate that into your way of life.
Definitely. Now, there's one more thing that we can also look at in terms of what exercise do for sensitivity, for insulin sensitivity, and that is the fact that when you are a regular exerciser, a regular physical activity user, you have enhanced glycogen storage. In other words, because of exercise, your muscles will pick up the excess glucose and store it in the form of glycogen. So glycogen is basically a molecule that is stored from glucose. If you have excess glucose and you don't need it, the body will store it. Kind of like if you have excess money and you don't need it, you put it in a savings account. Come on, man. In the same way, God has designed the body to do that. So if you have excess glucose, if you are exercising well, when you eat, the body finishes using the glucose that is needed. The rest are going to be converted into the bank, which is the glycogen. So that when you are fasting, we told you about intermittent fasting, when you are not eating and you need the energy, the body will release the glycogen back into the blood for what we call glucose, so that you can use it, and then your blood glucose level becomes stable all the time. Why? Because of exercise. So you store glucose when you don't need it, and you release it when you need it. So your blood glucose levels do not spike. It's just constant because of exercise. So if you are diabetic and you are not exercising, I don't know how else to stress it. And if you are 45 or over 40, or if you are overweight, your weight is up there, your doctor has told you got to lose some pounds. Even if it's 1 pound, it's still over. Or if you are of a race that is at risk for diabetes, or if you have a family history, one of your parents, your siblings, or even a close relative has diabetes, and you're not exercising, I hope by the end of this show you will repent. Come on, man. You will repent, because exercise will do you more good than harm. Make your blood glucose levels normalized, avoiding spikes of glucose when you eat, and avoiding spikes of glucose or low blood sugar also, as a matter of fact, because you are exercising all the time. Add anything to add on? All right, so we will go forward then, and the next thing we're going to talk about is the fact that exercise also helps with weight management. I know last time Gifty was careful to say that we don't exercise just because we want to lose weight. Some people, they don't want to exercise because the moment you think about exercise, they're like, but my weight is okay, I don't want to lose weight, why should I exercise? And she actually proved the fact that you still got to exercise whether or not you are overweight or underweight. Exercise has nothing to do with just being overweight or underweight. But then when it comes to blood sugar control, we employ exercise to lose weight. especially the weight that is around your belly. If you have a little bit of a heavy weight, a fat deposit, adipose tissue we call it, around your belly, around your belt. In the beginning of the season, we explained, I think Gifty was the one you actually gave the numbers as to where if your waist circumference is more than 40 or 40
40
for men,
for men and 33,
and 30, is it 33 or 35?
35.
35 for women, your waist circumference, your belt, if you close it, or if you use that tape measure and your waist circumference is bigger than 40, then you are at increased risk. So you can lose some weight there, And with that, if you are exercising continuously and regularly, you may be able to shed some of the pounds around the waist. And the moment you lose those weights around the belly, your blood glucose become better. Trust me, it's a fact out there that if your waist circumference is bigger, your sugars are high because you have insulin resistance. Because the fat there is preventing your insulin from working well, like we have already explained. So exercise will help you manage your weight and indirectly help you avoid high blood glucose. You want to add anything? I could keep going on and on with this.
Yeah, so I think this is no brainer, right? So we know that if your circumference is high,
Waist circumference, huh?
your waist circumference is high, it's likely that you have insulin resistance. And weight exercise, sometimes you may not lose the weight, okay, but at least you are able to manage your weight. So it's more like getting rid or making use of the excess sugar in your bloodstream. So exercise is always important to maintain or decrease your weight if you are overweight.
My goodness. And not just that, if you don't want to get diabetes, you may still get the benefit of exercise by losing some pounds, through exercises. And there's a lot of things that we can say about this. Suffice to say that just make sure that you exercise. Don't say that I don't need it. I don't have time is the most common thing.
We all don't have time.
Nobody
We are
has time.
always busy.
We are always busy. But you know how we make time to eat sometimes 3 times or 4 times a week? I don't know how we find that time. And yet we don't find time to burn it out. We got to make sure that we find time to do that also, because it's as important as eating. If you eat, then you got to burn some of them out, especially if you have weight around your waist. Then of course, especially as you get older, it happens because of all the processed foods that we eat, the sugary drinks, the juices, and all those things that the salt, everything is adding up to put some pounds around the belt. That is not good for you. And exercise will reduce your glucose resistance. And that's a good point that Gifty said. Some people may exercise and lose only about 2 or 3 pounds, and they don't lose anymore. Still continue to exercise. It means then at least you are still using some of the excess glucose, which could have been added to that weight. So don't give up and say that I've exercised and I've plateaued. It's true, you can plateau at some point. You lose a little bit and it doesn't seem to go away. Don't say that, oh, I'm not losing anymore, so I'm not exercising. No, you know that exercise does more. And as a matter of fact, just to throw in, even though we are doing diabetes education, every 10 pounds weight loss has a corresponding, I think it's a 5 millimeter mercury loss in blood pressure. So you're not just exercising to have glucose control, you're also reducing your blood pressure levels just by losing some weight. So it's as important as anything that we can think of. Lose some weight because of exercise and to avoid getting your high blood sugar levels. And I think there's, can go to the next one. The next one is cardio health. So exercise, apart from making you get blood sugar levels under control, it also improves your cardiovascular health. In other words, it helps you have healthy heart and blood vessels. You want to start off with that? Should I continue? Yeah.
Continue.
So exercise will help you have healthy heart and healthy blood vessels, and especially if you have a family history of diabetes, or if you have diabetes, one of the risks associated with having this disease for a long time is atherosclerosis, which basically means a buildup of plaques in your arteries, in your blood vessels. Plaques begin to build up. You know, those yellow substances that we talked about in our cholesterol season. If you didn't see it, go there and make sure you eat it all up, because there's a lot of information there. If you have diabetes, eventually, especially if it's not controlled, you become prone to heart disease and strokes, which is what is basically called cardiovascular diseases. And so, if you exercise, studies have also shown that exercising improves your cardio health. So, imagine you're diabetic, you are exercising, it improves your blood sugar levels. You are exercising, it improves your cholesterol levels. You are exercising, it improves your blood pressure levels. And you are exercising, it improves and protects your heart and your brain from getting stroke and heart attack, which is a constant, complication with uncontrolled diabetes. People who don't control their blood pressure, their blood sugar levels, either have heart disease or have stroke at some point. Some people die of massive stroke, and we find out that they had had diabetes over a long period untreated
Without knowing.
And the way they found out was the stroke, and then right after the stroke they put them on diabetes medication. So exercise will protect you on all levels, against any such cardiovascular diseases that you may think about.
Yeah. So you mentioned atherosclerosis, right? And I think in our cholesterol discussion, we mentioned that exercise increases your HDL. And when your HDL is increased, it's likely that it's going to take that excess fat, the bad cholesterol, the LDLs, away from the veins and the arteries, right? Back into the liver to be destroyed. So exercise has a lot of cardio health benefits that you can really enjoy in both sides. It's cut across. It's not just one side. It controls your cholesterol level. It increases the good cholesterol. It's working the heart. You're pumping the blood flow. So the slowness is taking it. You're making it work, and it's not like stagnant. So the blood is not static. It's moving. It's flowing. And because you're doing that, your heart become healthy. And in that case, your chance of getting stroke and heart attack is reduced. So a lot of benefits with our exercise.
My goodness. Exercise on the live. Exercise on the live. Make sure you exercise if you are not already doing that. All right. And so that is those are the benefits of exercise on your blood sugar levels and the things that we mentioned. Now, let's talk about some of the types of exercises. Somebody may say, but what kind of exercise? Let's talk about some. Basically, every exercise helps. Any physical activity that you can do that makes you burn sugar. It basically using the sugar in your blood. And the only way you use the sugar in the blood is to work your muscles.
Right.
So anything that you could do. But more specifically, studies have found that if you do aerobic exercise, which is an example of which our gentleman is doing, running, jogging, brisk walking, and all those kind of exercises that make you breathe harder, but that makes your heart pump faster, beat, in your chest, sweat, those exercises definitely help you control your blood sugar levels. Your glucose levels are going to be managed if you consistently do it. Remember, once a month exercise is not good enough. At least a couple of times, at least. But basically, no less than 3 times a week is the way you want to go. If you can do it every day, oh my goodness, that's when you're going to see the benefits right away. But any form of exercise, aerobic exercise, that which increases your heart's output, that which increases your sweat. If you're exercising and it makes you sweat, it makes you pant for air, those are the aerobic exercises. And you can name them. It can be brisk walking, jogging, running, treadmill, and whatever you think you can do. Those are the aerobic exercises.
Yeah, so sometimes some people have joint issue
Mm-hmm.
and they can't run or jump or like what this guy is doing.
Mm-hmm.
So we have other forms of exercise that can still pump your heart,
Mm-hmm.
So I think the next one would be the anaerobic exercise, the weight, you know,
Strength
the strength.
or resistant
Yeah, the
training.
resistant training. So that can still make you get out of breath because you are really pulling things, and that will definitely help your heart to work, and that will help you with all the aerobic need that you need. So if you have joint problem and you don't have the energy to be running, there are other forms of exercise that you can do. The resistant training, the lady here is not really running around, but after doing that
Wow.
for a lot of while, you can feel like your heart is really working, and you are reuptake a reuptake of glucose in in your bloodstream, and that can help control your sugar level.
Definitely. And even if you're pregnant people are also advised to exercise.
Which I never knew.
Something, yeah, you know, right?
Mm-mm.
Something that, like, maybe somebody may be watching is like, what if I'm pregnant? You too, you are not spared. You are not spared. You have to. There are forms of exercise for everybody. All right.
Especially if you are diagnosed with a gestational
Oh, yes. Diabetes.
diabetes,
Then you definitely
you
have to
definitely
do
have to
something.
be a little active whilst you're pregnant. That I know there is specific exercise for pregnant women available out there that you can also search and look for and use that.
Another form of resistant training is weightlifting. Weightlifting. I know ladies don't usually want to lift weights, but lifting weight will help. If you Google weightlifting, you see only guys. I mean, for the most part, but women too can lift weights. You just have to start small, however much you can carry, and do it. You don't have to be looking to be buff. You don't have to be looking to get six pack. No, that's not what we're saying. Just lift some weight. Just activate those muscles, those biceps and triceps. By doing that all the time, you are contracting and relaxing the muscles. Is where the glucose get burnt.
Right.
So just do some resistant training, especially weightlifting, and that will do you good because it's going to again pick up glucose from your blood and burn it while you do this. And so the glucose will not be in the blood doing nothing and making your blood sugar levels go high, making your diabetes numbers go high. No, no, no. You are using the glucose. And especially if you do other things with it, that will be what you want to do moving forward. All right. So that is that one. That I think there's another one. So we are actually saying that apart from those exercises, you cannot just say that because of exercise, because I'm exercising, I'm done. Control of blood sugar levels or diabetes is a multifaceted approach. You have to hit all the areas that will help you. So, though we have talked about the importance of exercise and some of the good exercises that you can do, you still have to remember to have your diet also managed well. And we didn't talk about the HIIT, the high intensity. Let's use this opportunity to talk a little bit about it. That kind of exercise also helps. So, one other exercise that helps, I'll talk about the high intensity, to talk about interval training, is what we call high intensity interval training, or HIIT. And again,
HIIT.
steady, yes, HIIT, HIIT. Whether you call it HIIT or height, just remember there's high intensity interval training. And what that kind of exercise does, or what you do for that kind of exercise, is a combination of brisk. If you are running, run very, 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 very fast. It's intense, and then you stop at some point and then rest. Give yourself some room to rest, and then you start again. Run again, very, very fast, very intense exercise. Then you stop and then you rest. That is, the data has shown that that decreases your glucose levels. It's right there. And then, give to talk about the interval training, or you want me to?
Yeah, go for it.
So the interval training is also, you do the high intensity training, and instead of stopping and resting, you slow down after some point and do regular exercise. So if it is an exercise between, running on the treadmill very, very fast, maybe you do that for like 10 minutes, 1 mile or whatever, but very fast, trying very fast. Then after those 10 minutes are up, you go to very slow walking. So that is interval training. Or you can pair running with weightlifting.
Right.
All those combinations, however much you do. I usually do treadmill and weights so that I get the benefit of both. But if you don't have weights in your house and you have only treadmill, you can do either the interval or the high intensity exercise. However much you can pair them up, you got to do it in your own way. But the key is doing nothing is what we don't want you to. If all you can do is slow exercise, thank God you are doing something. As long as, thank God you are doing something, right? What we want is that you do something. We cannot afford not to do any exercise. As the age catches up with you, 30s, 20 somethings, especially with the foods that we eat, you got to add exercise and consistent exercise to it. That is the key to go. And then this slides become very important, which is your diet. Adding your diet also will do that.
Yeah, and with the weights, I think I just realized that we sell the weights almost every pharmacy. I just realized that we sell the 2 pound weight, the 5 pound weight, the 10 pound weight. As a lady, you can do from 2 pounds to 10 pounds. That's not much. Then you just slowly increase your weight. And if you have a skipping, like the rope to skip, that can be the HIIT training.
The high intensity.
That we are talking about. You skip for some time.
Very fast.
Very fast, you put it down, then you pick up your weight and go with the weight and put it down, then you skip for some time. So doing that back and forth is likely that you are going to really use up a lot of the glucose in your bloodstream.
My goodness. That's what's up. Now, if you are benching metals like this, there's no way your blood sugar is going to go up because the sugar has a work to do. The sugar has a place to be used. But if you are sat in the in the couch and eating popcorn and flipping the channels and no exercise, some of our people, eating these high starchy foods, especially at night, thinking and saying that as for me, I can't stop this food. Well, yes, you can. My goodness. Yes, you can. It is possible. Everything is possible if you really put your mind to it. And we encourage you to do that because every little thing will make a little impact. And you may think that, hey, as we always say, some people say that everybody will die, leave me alone. Let me enjoy my life, After all, what? No, don't say that. Be responsible. You are a steward of what God has given you, which is your body. You are going to give account, especially if you don't treat it well and you become a stroke victim, whether you pass away or you become broken down because you didn't manage your blood sugar well or because you did not believe in conventional medicine. Some people, I was listening to, I think it was a Facebook, something that was listening to this 35-year-old person that died because they are scared of needles. They didn't go to the doctors, and infection in the hand eventually probably got septic. They became septic and they died. 35-year-old, and the only reason why they wouldn't go is that they are scared of needles. So they will go to these houses of prayer, and then pay amount to sacrifice, money there for them to be prayed for. We all believe in prayer, but when it comes to the physical body, Jesus called people who were doctors into his ministry. So if he didn't believe that medicine is something that we have to do, then he wouldn't do that. He would have shunned those guys. He had people who were doctors that he worked with. And so don't let anybody trick you into thinking that this one, I don't believe this, or this one, it will happen anyway. No, do your part. Do your best. At least, if not for yourself, for the family around. Don't put anybody in an undue, situation where they would not want to be in that. make sure that you take care of yourself. Exercise will do that for you, definitely.
Yeah, and comprehensive what was the title again? It's like
Oh yeah, the
it's
comprehensive care.
comprehensive care. It's not just the exercise, but it's with diet, right? And we discussed diet last week, and we are adding on the exercise. And I think I've mentioned this also before, that if you really want to lose weight, with a diet, it's 80% and the exercise is only 20%. So you can't say that I'm exercising and I'm using all the glucose, so I have to keep eating. And one thing that I have personally noticed also is when you exercise, you feel hungrier, like you want to eat more. So you just have to see what you can do differently. So we know that there is like protein shake. So you have to increase your protein intake because you are using up a lot of the glucose into your muscle and you're building more muscles because you're exercising. So if you're not careful, the reason for exercising will be lost because your body will feel like, oh, I'm hungry, and you will tend to eat more. So when you exercise, you just have to also remember that it's not just the exercise to help you with your weight management, the food that you eat too, and the kind of food that you eat. So if you're exercising and you go back and eat all carbohydrates, then the purpose for exercising is lost here. So you have to increase your protein intake so that you don't feel hungry too quickly after exercising. Then you'll be able with the two, you'll be able to manage your weight.
Oh my goodness, my goodness, my goodness. That is very important. And I'll add fiber-rich foods also. The
Yes.
greens and the beans and the legumes and the peanuts and stuff, they fill you up so that you don't get easily hungry. After the proteins, and some of them actually have very high amounts of protein too. So, uh, you know what? We don't want to do last week's show on top of today's show. So please, after this, check back on the last week's show. We delve deeper into
Diet.
the diet way of controlling your blood sugar levels and overcoming diabetes. So now that with that being said, I think we are going to end, but we just want to remind you that next week we are going to talk about medications and insulin options. What are some of the options available to control your blood sugar levels using medications and insulin? Unless we find something more interesting, that needs to come before this, we will hit on this topic and potentially explains what are some of the options out there. There's a huge list of medications that are used to treat diabetes. We cannot use one show or even two shows to discuss all the medications out there, except to say that we're going to hint you to the most popular ones and potentially encourage you to take those, even if you have side effects that we could potentially, discuss on here how to manage them. So next week, make the same time with us at 6 p.m. Eastern and 11 p.m. GMT, or watch after the live show and make sure you are subscribed. Of course, we want to make sure that we roll in that knowledge together. And we have about 16 loves and 6 thumbs up. That is huge. We want to say thank you to all those. My goodness. Thank you to all those who hit the like button and the love and the thumbs up. And I'm believing, I don't see the follow and the subscribe. So I'm believing that you guys have also done that. So God bless you. And until we see you again next week or before, we will say, Beloved,
we wish above all things that you prosper and be in health, even as your soul prospers.
Thanks for watching.
Thank
God
you.
bless.